Hello, my name is Kalpathy-Cramer, and I'm at the Martino Center for Biomedical Imaging at MGH in Boston. Our lab works at the intersection of computer science and medicine with the goal of improving healthcare through computational approaches. As you'll hear in a minute from a number of people from the lab, our lab is a very diverse collaborative environment with members from across the globe and with a range of backgrounds and interests. We work pretty closely with clinicians in many different domains, including in radiology, oncology, and ophthalmology, to develop clinically relevant tools and techniques that can eventually be translated into the clinic. Although most of the work that we do has a strong clinical underpinnings and motivations, we are also keen to advance technical and foundational aspects of machine learning. We work in areas such as federated learning, explainable AI. We are very keen to explore the generalizability of deep learning models and improve them. Certainly things like image registration and segmentation are active areas of interest. And we are very passionate about being part of the open source community. We try to make a lot of our code available open source, and we are part of many open source frameworks such as Monai and others. Our lab website describes many of our projects and publications and lists our members. Please feel free to reach out to me or anyone in the lab to hear more about the work that we do.
Hi, my name is Katie. I'm a fourth year HST PhD student, and my research focuses on uncertainty quantification for deep learning models to help to identify the cases for which the model failed to make an accurate prediction. I'm an MD by training, and so what I really like about QTIM is that that's a really interdisciplinary lab, and that bridges the gap between engineering and medicine. Besides the exciting research that's going on, one thing that was very important to me when I chose the lab is the emphasis on a healthy work-life balance, which is really something that cannot be underestimated during a PhD.
Hey, I'm Praveer and I'm a postdoc at the QTIM lab. I'm working to understand the generalizability of deep learning models across medical institutions and population demographics. I like QTIM because of the academic freedom that we get to pursue our research interests, as well as the democratic way in which most decisions are taken in the lab. Particularly as a postdoc, I have got plenty of support in terms of grant writing and other career development plans.
Hey, hi, I'm Chris. I come from an engineering background with a master's and PhD in engineering. Now I'm working as a machine learning scientist at QTIM, which means that I primarily work on some of the commercial partnerships that we have. So through this, I've worked on a bunch of very interesting projects for commercial deployment, including neuroimaging projects, detection of fractures, and body composition analysis. The one thing I really like about QTIM is the range of different projects that we work on, including more theoretical projects and areas that are more clinically focused in a wide range of different clinical areas, and about the different people that we collaborate to make that happen.
Hi, my name is Biba, and I'm a master's student at MIT finishing up my master's thesis with QTIM. My research is using image registration to improve disease prediction networks, specifically for COVID at the moment. I really like working at QTIM because the research we do is very translational and it's often actually used in clinical applications, so it feels very fulfilling. And even though I joined the lab when we were all completely remote, I feel like people have been very supportive in making sure each other succeeds. And people have reached out to me to check in. And I think that whether it's help in getting the first experiment set up or collaborating while writing papers, everyone is very supportive. I also enjoy the attempts that we make at socializing online through online gaming socials.
Hi, I'm Charlie. I'm a machine learning scientist in the lab, working on projects like detecting stroke in CTA and federated learning for healthcare. One aspect of QTIM I really enjoy is their collaboration with industry partners such as GE Healthcare and NVIDIA to help build real clinical products for applications in medical imaging and to help shape the future of healthcare.
Hi, my name is Jay, and I'm a PhD candidate working in the lab. I work on image segmentation using deep learning, specifically relating to primary and metastatic brain tumors. I like the fact that our lab is composed of people of all experience levels, ranging from undergrad interns to postdocs to medical residents, Moreover, we have a welcoming environment open to people of all cultural backgrounds and strive to build a community of respect, learning, and also fun.
Hi, my name is Ben Burse, and I am a web developer and analyst in the QTIM lab. I often combine data analytics with user interfaces to provide interactive experiences. Our work requires expert opinions in order to train our models, and I get to build apps that streamline the acquisition of those opinions and help build the ground truth for these models. I like working in the QTIM lab because I get a chance to work on really challenging and diverse projects at the intersection of software development and medicine. My coworkers are really collaborative and help me when I don't know something in the clinical realm, and I get to lend a hand on the software side if they need help. I also enjoy having our summer interns join us in the lab as we get to show them real world examples of what graduate students and scientists actually work on.
Hi, I'm Mishka, and I'm a third year PhD candidate in the lab. I joined QTIM last year. The focus of my research is using deep learning models to predict response to therapy in various oncologic situations. My current project focuses on predicting response to immunotherapy in brain mets patients. My favorite thing about QTIM is that it really brings together the theoretical with the translational, and we have experts on both the machine learning side and the clinical side.